I knew that I wanted to do something in the surgical field. I also had an interest in ears because I studied music prior to going to medical school. There's so much intricate anatomy in the head and the neck. I knew that's where I wanted to practice. At Chicago ENT, I practice general otolaryngology. So I see disorders of the ears, anything from ear infections to conductive hearing loss. I treat a variety of sinonasal disorders. We help people breathe better. We treat sinus infections with in-office and other techniques. We do a variety of throat procedures. We take care of sore throats and chronic tonsillitis. I have a particular interest in different types of hearing disorders, eustachian tube dysfunction, and treating dizzy patients. We treat a lot of patients with head and neck cancer in the practice. And it's a privilege to take care of those people because you're meeting someone at a very, very stressful time, especially at the initial diagnosis. Luckily, we're at the forefront of treating those types of patients, so we can provide a lot of therapies that are minimally invasive or non-surgical. I met with a couple who were in their 70s who've been married for 50 years. The wife of the patient had recently just overcome her own bout of cancer. Now she was there with her husband, who I'd recently diagnosed with a tonsillar cancer. When you hear that diagnosis, it's terrifying. But after helping him and talking about different treatment approaches, he went through a successful course of treatment. And seeing them back at the initial visit after that and having gotten the first scan that showed no evidence of persistent cancer or any sign of distant spread was such a relief for them and such a gratifying thing to be able to have been a part of. My practice philosophy with respect to patient care is really to let the patient speak and understand where she's coming from, and then really partner with her and try to find the best approach based on her philosophy. Some people come in and they want to just know what the problem is. And once they know what the problem is, that's enough for them. Some people want to know what it is and then they want to fix it. And to some people, that means the most aggressive, the most invasive type of thing they want done. But for other people, that might be something like acupuncture or taking herbs. To some people, that means seeing an allergist. So there's a variety of ways that we can treat these problems, and it's important from my philosophy to know where the patient's coming from. Because to be successful, you have to be a team. As a practicing physician, what I enjoy most is making an impact in someone's life. We have the ability as otolaryngologists and ENT doctors to really improve quality of life, whether it's breathing better during the day, whether it's sleeping better, whether it's hearing better. I like being able to hone in on what's bothering the patient and provide a practical solution, and then to see that patient back and know that we've made an impact.